From Georgia to New York, these two Mercer bears have left home to work in one of the nation's biggest hotspots for COVID-19, New York City.
Right now, all of these patients are like strictly COVID patients. So it's like you've kind of just mastered a routine of how to care for them. And it's just, I don't know, it's just very different.
Basically, the patients who are in the COVID ICU are the ones that are obviously not doing well. So pretty much everyone's intubated. We're focusing on a lot of respiratory issues, but a lot of them have comorbidities. So we're having to treat each patient very individually based off of whether or not they also have diabetes or congested heart failure, whether or not they're HIV positive, so they already have a horrible immune system. It's a daily process of coming up literally with a new game plan for each and every patient based off of their current condition.
With the ever-evolving uncertainty surrounding COVID-19, both women say they wouldn't have had the confidence to care for the most vulnerable had it not been for their education with Mercer University's nursing program.
Because so many patients are sick and on so many different medications, usually patients will run their medications through their IV using a pump, and you just kind of program it and it does everything for you. We have a shortage of pumps. And one thing that Mercer, Georgia Baptist College of Nursing specifically, really drilled into us, and we got tested on every semester and had to make a 90 or above on the test, was to learn how to do this kind of stuff manually without the pump just in a situation where we didn't have pumps available. And I've had to do that like every day.
As a nurse graduating from Mercer, very, very proud alumni from that school, because I just feel like I'm very comfortable with my skills across the board. Mercer taught me how to be involved in different nursing organizations, and just the knowledge we received from them is just amazing.
But what's helping these former bears stand out isn't just centered around the medical education they received at Mercer, but the bedside manner and empathy that they were also taught to have.
They taught me to make sure to pay attention to the little things, to treat the patient, not the machines. And so this is a really hard time for these patients, because not only are they sick and they're scared, and a lot of them know that they're dying, they can't have their loved ones come and see them. And so you're adding this entire extra emotion of loneliness and helplessness to the process of while they're dying. So we've done little things for them, like play music and dance with them, even though they're like semi out of it. We had one patient whose family gathered outside on the street, and we didn't have a room available where we could get him to a window. We just pushed him into the hallway area where the window could see him. And they all had signs and balloons, and they were waving to him from the street. And so he got to see his family that way. I painted my patient's toenails the other day just to make her like little things like that. And
Erica Haywood and Victoria Collins, two bears changing the world, one patient at a time.